Hey guys, sorry we're not live right now due to some technical difficulties, but we're going to record this short video so you can watch it anytime you want, and then we'll also give you a tour of our office at the end of the video, so stay tuned. I'm Susan Rosemeier. I'm a therapist here at Cristina, Panaccione and Associates. I have my master's degree in professional counseling, and I'm working towards licensure, which I should have in another year. So I'm currently under supervision from the owner, Chrissy. And this is...
Hi, my name is Alyssa. I work primarily at this location in Upper St Clair. I have my license in professional counseling, and I also have a certificate in addictions. And we have two locations, and this is the first one. This is in Upper St Clair. We're right next to Outback and right down the street from the high school. And there are several of us that work at this location and several work at the other location. Susan's primarily at the other one.
And that one is located in McMurray, so it's literally at the other end of East McMurray Road, right by Peters Township High School and Donaldson's Crossroads. So yeah, there are a total of 8 of us, so we are 2 out of potential 8 that you could see. And we all have different specialties. So some of the things that we treat are anxiety, depression, family stuff. What else?
We see kids, couples, and individuals, and I primarily see a lot of postpartum. I see a lot of addictions, victims of sexual abuse, and we also have people that specialize in kids or in the elderly population.
So pretty much whatever your needs are, someone can meet them. So if you call our practice, you will probably talk to Chrissy, the owner, and then she will try to match you with the best fitting therapist for you. So we really try to work with you to find out who will fit your needs the best. So we take private pay and also most insurances. So right now I can only do Highmark, Blue Cross Blue Shield, or private pay. Alyssa?
Same for me. I'm working on getting credentialed for other insurance companies, but across the 8 of us, we will most likely take your insurance.
Yep, absolutely. So since we're offering free screenings today for anxiety and depression, maybe we can just list out a few symptoms of either of those. So maybe you can figure out if you're feeling some of those things. So we'll start with anxiety. So just general anxiety symptoms, basically excessive worry. If you find yourself worrying all the time about things that maybe you think other people don't even think about or worry about. Sleeping issues, if you have trouble getting to sleep because your mind won't turn off, or staying asleep if you wake up at all times of the night, or you wake up really early and can't get back to sleep. Oftentimes that can be an anxiety symptom. Physical things. What are some
Sweating, heart racing.
Yes. Tension headaches, backaches, all of those kind of things.
And then for depression, if you're losing interest in things that you normally enjoyed, you tear up, you're unable to get out of bed, or whenever you are able to get out of bed, your hygiene is suffering. Those are some common things for depression.
Absolutely. And a lot of times people are really worried about, well, is what I'm feeling really that bad? I see a lot of people who have that question. They feel like they don't deserve to come to therapy because their problems aren't as bad as someone else's. Those are the people I actually really want to see because I think you deserve it too. You deserve to have your time and space one-on-one with someone who actually cares what's going on with you. Because it matters just as much even if you didn't go through this horrible thing that someone else did. So I think that's pretty important.
I see that a lot too. People telling me that they know their problems aren't as bad as the other people that I'm seeing.
Yep.
But I always tell them that, everyone has their own issues and that they deserve the time as well.
Absolutely. So maybe that's a good question that we can answer. What are some common questions that people usually have about therapy in general? I know a lot of people, it's tough just to make it to the first appointment. A lot of times people will just not show up or they'll cancel their first one, especially if they've never done it before.
I also see people that they'll come for their first session and they'll come in and they'll tell a complete stranger all the stuff that's going on, and then they overwhelm themselves and sometimes are even embarrassed of what they might have disclosed, and then they don't come back. And then they'll email in a couple weeks and be like, I'm really sorry, I'm ready now. That happens a lot.
Yeah, absolutely. So sometimes I tell people the hardest part is just making it to that first appointment. Because it's scary, and you don't know if you're going to be sitting across from this person who just stares at you the whole time with a straight face and doesn't talk. So I promise we're not like that. Our personalities are kind of like what you see. It's definitely a back and forth, a mutual relationship. So I promise it's not as bad as you might think. And it's also about fit. You might not get along with every therapist that you see, and that's okay too. So we really try to match you with the best fit. And don't be afraid to keep trying. If the first one doesn't cut it, that's okay too.
If you need to counselor hop and find it to make sure you feel the most comfortable, that's totally normal.
Yeah, we won't be offended either if you say that. Another question would be, how long does therapy take? Sometimes people come in hoping that, one session, everything will be solved and they'll feel better. Probably not the case. It really depends on what's going on with you. If you are interested in going into the reasons why things are happening, maybe like family background, why you do the things you do, why you are the way you are, that's going to take a little bit longer to dig into like some background stuff. So that could be, months to a year or two. Some people they know what they want, so they get in, they get out in a month or a few sessions, and we're done. But I'm really open with people that I see about what do you expect, what do you want, what do you hope for, so we can both kind of get you to where you want to be, and not a huge amount of time.
Right. Sometimes, usually when you start out, you come every week for a while, and then as you start to reach some of your goals, coming every other week, and then once a month, sometimes for maintenance. I have people that just come once a month and have been doing so for over 2 years, just in terms of maintenance and kind of their hour of self-care for the month, like really talking about what's been going on and any things that they're continuing to struggle with, but they've reached most of their goals that they set initially when I saw them every week. So that's totally an option as well.
Yeah, or some people need to take breaks if their life gets really, really busy. I have a couple people doing that right now. They're like, hey, Susan, I'll call you in a couple months. I'm doing okay right now. I have a lot going on. I don't want to keep canceling, so I'll call you. That's okay too. Just take a little bit of a break, and then when the next thing crops up or you feel like you need to come back, doors are always open.
Again, we apologize for not being able to go live. Definitely technical difficulties. We hope we answer some of the questions you might have been wondering when we advertised our event today. If you have any other questions, you can comment on this video. We'll definitely attempt to do this again.
Actually live.
Yes, actually live, where we can answer your questions actually sitting right here. But if you have any questions, you can comment on our posts. We're going to give you a tour so you can kind of see our building and what's the location in terms of where we are in Upper St. Clair.
Because that might give you anxiety too, like not knowing where to go. So
we have parking.
Yes, there's parking. So we'll kind of take you on a little tour around so you can see. Okay, guys, so we're outside of our building. This is our sign for free anxiety detection screenings. This is our parking lot with a view of the office. We're right next door to the Outback, which is to your left. And then you go through this first door on the left-hand side that says 37 McMurray Road. Okay, guys, so after you come in through the front door, you'll come up the first set of stairs into our hallway, and you'll walk down to room 204. This door will be closed. You don't have to knock. Just come right into the waiting room.
Okay, so this is the waiting room.
And then this first office is Alyssa's.
There's the first office.
And then here is another second office over here. And then here's Chrissy's office down here. Thanks for joining us, guys. Sorry we weren't live, so hopefully we can do that again sometime soon. If you have any questions, please feel free to leave a comment, and we will get back to you on that. And then next time, we'll do
a tour of her office, so you guys can see what that looks like.
A tour of our McMurray office. So see you later.
Thank you.